very good morning to one and all. I am Shalini Fernandez, one of the OET aspirants from EduSkills International platform. I take this opportunity to thank Father Saleen Joseph, our dear mentor, for providing us an opportunity to present what I have learned through his teaching. Today I am going to talk about OET reading part C. As Father Saleen has given us the strategies, we have a method which is used to read part C, that is QTA method. You read the question first, then go to the text, then go to the options or the answers. Today, let's talk about heart failure reading part C, and it is a genuine material, authentic material from OET website. I thank OET website for allowing us to use this material. Let me begin now. As we all know, in OET part C, we have got two texts. Those two texts are different. There is no thematic link between two texts, but there is a thematic sequence or thematic link within the text. So it is our duty while we practice to sequence the text. Every subset of OET has got its own sequence or the pattern of presenting it. So in OET reading part C, we must learn to sequence the content in the text. The sequence should be, the content is given in the paragraph form, and if the paragraph is not numbered, we have to number it as soon as we get it in our hand, because the questions comes from the different paragraph where we need not waste time searching which paragraph it is. So it is very important as we get the paper in our hand to mark the paragraphs 1, 2, 3, so and so forth if the paragraph is not numbered. Hope it is clear to all. Then, as Father always says, there are particular tips and strategies that we need to use, such as once we get the text, we need to skim and scan. For what we skim? We skim for maybe the adjectives, modal verbs, or it is like time sequences, or it could be what you say is contrast and comparing, or it is maybe it is like dates, numbers, percentages, persons, and also many other things which already we have dealt and we are well aware of it. Now let's move on. Now let's deal with question number 7 to 14. It is a pattern which is there in the exam. So, what is the question? According to the strategy, we read the question first, then we read the text, then we'll go for the option. So let us see. According to the first paragraph, simaglermen. Okay. According to the first paragraph, simaglermen. Now we have to fill in or continue the sentence. So let us go to the text. Let us see here. Heart failure patients have weakened hearts, but you see there is a contrast but. Researchers say is the opinion, okay, an experimental drug used for the first time. You see the sequential expression, okay, first time in humans may repair heart cells. May is a modal verb, it is used, and improve heart function. According to the results of a small phase 1 trial, a single intravenous infusion of the drug simaglermen was safe and at high doses improved heart function for at least 3 months. 3 months is the time expression again. So, being read the text, let us understand what is the question. According to the first paragraph, simaglermen. semaglutide is a drug, right? Semaglutide is a drug. Now they want to say what it is. Now when we see here, let us find out the keywords. Keywords here are experimental drug, results of a small phase 1 trial. Okay, these things say that the trials are going on. They have not concluded. Still the trial is going on. So option is safe and used in high doses. Does it say that? They say here, according to the results of a small phase 1 trial, a single intravenous infusion of the drug semaglutide was safe and at high doses improved heart function for at least 3 months. So, high doses, they don't say that it is safe. They say that at high doses improved the heart function for at least 3 months. So, the first option is not correct. Second one, improves heart function indefinitely. Does it say? No. See, they are saying at least 3 months. That is not that it is indefinite. That means it is for long. No. So the option B also is wrong. Improves. Improves is present continuous. But it said that improved past. You see, that also you need to focus. And indefinitely means there is no time sequence or there is no definite period or interval given. But in the option there is an interval given, so it is not indefinite, right? And option C is undergoing trials. What is undergoing trials? Undergoing trials is nothing but the drug is experimented. So it is given here. But researchers say an experimental drug used. So for the first time, see, they are doing it. They use this one for the first time. And according to the results, what they did, they found this. So that means it is going on in experimenting. They are doing it and it is not confirmed. So is undergoing trials and is used in high doses. They don't say it is used in high doses. They don't mention about it. So what is the option? Option C is the correct answer because it is undergoing trials. So how do you say? Because they say heart failure patients have weakened hearts, but researchers say an experimental drug. That means they use one drug for experiment and still they will be using because they want to find out what it is because only the first phase is over. Okay, so experimental drug used for the first time, which indicates that the drug is undergoing experiment. And also they are saying according to the results of small phase first trial, a single intravenous infusion of the drug was safe. So still they have to come to the conclusion. So according to me, the option C is the correct answer. Is that clear? Yes. Let's move on to the second question. Which of the following statements does Dr. Lenihan make? Now we have to see only what Dr. Lenihan make. There may be many people who talk about this or many people may have the statements given, but our interest or our focus is about Dr. Lenihan. So that is very, very important. And they have said, which of the following statements does Dr. Lenihan make? Let us go to the text now because we are using QTA method. Right now, we have many therapies that we use for heart failure. And these patients, who are these? These is a reference here. Okay. These patients is nothing but the patients who are undergoing these many therapies. Where on all of those therapies and still is a contrast there, had significant heart dysfunction, said the lead researcher Dr. Daniel Lenihan. He is a professor of medicine and director of Vanderbilt University's Heart Clinical Research Program in Nashville. Right now, what is right now? Time sequence. Many, again it is a scale. These patients, reference, still is a contrast and all is, it is a scale. Now, being known this, and if you read the question, which of the following statements did Dr. Lenihan make? You go for the option now. Patients who received semaglutide were on many other therapies. Okay, were on many other therapies. You just see here, right now we have many therapies that we use for heart failure. And these patients, who are the patients? patients who are in the study, okay, were on all of those therapies. All is everything. So many therapies and all, and still had significant heart dysfunction. That means having all the therapies given to this particular group of people, still they have heart dysfunction. So the option A definitely is the correct. Why? According to him, patients who receive semaglutide were on many other therapies. Option 2, patients who receive semaglutide suffered from heart failure. They don't say that. Anything is there they suffered from there? No, they don't talk about it. Patient receives semaglutide at Vanderbilt University. No, it is the person, that professor is from this university, not that they were the patients or something were from this university. Patients who receive semaglutide were not on any other therapies. They don't mention. They say that they were on all of those therapies. So definitely the answer A is correct one. Is that clear to you? Yes, because you see many therapies that use for heart failure and all of those therapies and still add significant dysfunction. These patients, who is this patient? Patients who receive semaglutide. Okay, so it is just paraphrased here. Patients who receive semaglutide is nothing but these patients. Okay, because they are doing the study on patients who receive semaglutide. Understood? So these patients refers to patients who receive semaglutide. So it's a reference type of questions, and they are on many other therapies. So many therapies is nothing but many other therapies. Hope it is clear to all. Can we move to the next question? Yes. Question number 9. Which of the following therapies are not mentioned by Dr. Lenihan? See, lot of things doctor has mentioned, but one of the thing he has not mentioned. So what is that he did not mention? Now read the text, because QTA method, we don't read the option first according to further strategies. We have to read for the text first. Let us read. People with heart failure often take a combination of drugs, Lenihan said. These include, what are the drugs that they take? Medication to lower the blood pressure and diuretics to help remove the excess fluid that builds up as a result of heart labor pumping ability. In addition, some people have implanted defibrillators or pacemakers. Even with all these options, the death rate among these patients is unacceptably high, Lenihan said. So you see the option now. Which therapies are not mentioned? So therapy to decrease high blood pressure? Yes, because they said that lower blood pressure is nothing but decrease high blood pressure. Right? So decrease high blood pressure is nothing but lower the blood pressure. So it is a paraphrase, or we can say synonymous language that is used. Diuretics to help remove excess fluid. Diuretics to get rid of excess fluid is nothing but remove excess fluid. Remove is get rid of. Okay, synonymous language. Remove is get rid of. It is mentioned. In addition, some people have implanted defibrillators and pacemakers. That also is there. So these three things are mentioned by the doctor, but therapy to increase low blood pressure is not mentioned. Is it mentioned anywhere? No. To increase low blood pressure is not mentioned. So this is a right option. It is very simple. So you need to understand synonymous language, synonyms, paraphrasing, and try to find out the keywords. Keyword here is not mentioned therapies. Okay? Therapies that are not mentioned is a keyword. So it is definitely clear. You can see decrease high blood pressure is a keyword. Get rid of excess fluid is a keyword, and the pacemaker defibrillators are keyword, and low blood pressure also keyword. So there is no blood pressure, low blood pressure, but lower blood pressure is there. Lower blood pressure is not increase low blood pressure. Lower blood pressure is to decrease the high pressure. So the meaning you need to understand. Hope. Can we move on to the next question? Yes. What is heart failure? Very simple. It is a definition kind. So, what is heart failure? Heart failure, a condition where the heart can't pump enough blood to meet the body's needs, is among the leading causes of death worldwide. A significant number of heart failure patients don't respond well to current treatments, particularly those patients with left lower chamber which pumps blood into the arteries is weak, Lenihan said. So now the definition. You see the options here. Heart failure is a condition in which lower heart chamber is weak. Where did it mention here? They are not mentioned. They say left lower heart chamber which pumps blood into the arteries is weak. But they don't say that lower heart chamber is weak. That is not mentioned. Heart failure is a condition in which the left lower chamber pumps blood into the arteries. What it is given? Particularly those patients who left lower heart chamber which pumps blood into the arteries is weak, Lenihan said. But what is say is here a condition in which left lower chamber pumps blood into the arteries. It is not mentioned. Okay, they tell about the deficiency of left chamber saying that it is weak, but it is not mentioned what you say. But the option C, a condition in which the blood pumped by the heart cannot satisfy the body's requirement. The synonymous language cannot satisfy the body's requirement is nothing but cannot pump enough blood to meet the body's needs. See, exact the synonymous language they are used it, and they are said here a condition in which the blood pumped by the heart. Heart cannot pump, pumped by the heart. It is a paraphrasing here. Right? The sentence is paraphrased here saying that heart failure is a condition where the heart cannot pump enough blood to meet body's needs. Whereas the option is a condition in which the blood pumped by the heart cannot satisfy the body's requirement. So this is the correct answer. And the option D, a condition for which there is no treatment, it is not mentioned. So that is the way we find out the answer. Okay, coming to the question number 11. According to Dr. Lenihan, semaglutide. According to Dr. Lenihan, what is semaglutide? Semaglutide acts as a growth factor for the heart, helping it repair itself following injury, Lenihan said. So, what he say? According to Lenihan, he say it helps to repair itself from injury. Where do you get this synonymous language? Replaces receptors on the heart surface. They don't talk about. Okay, they don't talk about replacing. They say that it binds, yes. Second, helps to enhance the size of the heart. It is not mentioned. Aids the heart's recovery process. What is the recovery process? Recovery process is nothing but helping it repair itself following injury. When you have injury, you get repaired by yourself. That is the process. That is a recovery process, and that's the right answer. Heart's recovery process is nothing but repair itself following injury. Helping, aids. Aids and help is synonymous language. Aids the heart's recovery process is a paraphrased saying that helping it repair itself following injury. So this is the correct answer. Hope it is very clear and simple. Let's move on. Which of the following consideration is not part of the approval for a new drug? So when you do the approval for the new drug, you need to do so many things. Now you see they are saying which of the following consideration is not part of the approval for a new drug. A phase 1 trial like this one is designed to see if a new drug is safe. So safety is there. Safe is nothing but safety. Not to test its effectiveness. So effectiveness is there. Then before semaglutide could be used to treat patient, it must prove its worth in a series of progressively larger and challenging trials. Challenging trials are there. Then after seeing the safety, not the effectiveness, and putting the things into challenging trials, then you go for approval by the US Food and Drug Administration. The process can take several years. Based on these preliminary findings, the safety, effectiveness and challenging, larger trials are being planned. After seeing that larger trials, after you get the consideration or the approval for safety, effectiveness and challenging trials, you will be doing the large planned trials. So planned trials is not there in the approval. Is that clear? It is very, very clear if you understand what is the synonymous language, what are the synonyms, and what is paraphrasing. You will definitely understand. You see, before the time sequence is given, could be modal verb is there, series again it is given, progressively again sequence is given. Then you see everything is there before you could get the answer. So answer D is the correct option. Question number 13. Which of the following results were achieved with semaglutide? So they have done the trial and they have come to the conclusion what was good, what was not achieved. So go to the options. Before going to the option, go to the text. For the study, Lenihan and his colleagues randomly assigned 40 patients to get an infusion of semaglutide or a placebo. Compared with patients who received a placebo, patients given a high dose of semaglutide had sustained increase in the heart's ability to pump blood. The improvement lasted 90 days with the maximum increase in heart function reached in 28 days, the researchers found. And the most side effects were so and so. Now what is the question here? Which of the following results were achieved? Option is C. Semaglutide did not produce any results. No, it did produce. What they did? It had sustained increase. So option A is wrong. The effects of semaglutide adverse. No, it is not adverse. The most common side effects were headache. There were no adverse effect, but there were side effects, yes, because any drug will have a side effects. Semaglutide improved the heart's ability to pump. Had sustained increase in the heart's ability to pump is nothing but improved the heart's ability to pump blood. So that's the right answer. Improved the heart's ability to pump blood is equivalent to had a sustained increase in the heart's ability to pump blood. You see the synonymous language they used, or we say the paraphrasing done here. So that's the correct answer. Semaglutide may produce several side effects. No, the most common side effects were headache and nausea. There is no several, only two are there. So it is understood. Option C is the correct answer. Hope it is clear to all. Let's move to the next question. Question number 14. Which of the following is the most suitable title for the article? After reading this text, you need to tell me what is the best title. Despite the encouraging results of this first trial, a lot more testing will be needed before semaglutide can be considered a standard treatment for heart failure. Understood? So, these findings need to be replicated. So, the option is C. Which of the following is the most suitable title? A promising new drug treats heart failure? They did not say that because they have not concluded. They are saying semaglutide can be considered a standard treatment of heart failure before it should undergo so many things. So it is not the right. A new heart failure drug shows promise in first human trial. Yes, it is a correct. Promise is nothing but encouraging results. Encouraging results. First trial, it shows the encouraging results. So that is the suitable title here. A new heart failure drug shows promise when tested on animals. They don't talk about it. A promising new drug that treats heart failure has a bright future ahead. That also doesn't talk here. So the correct answer is a new heart failure drug, that is semaglutide, shows promise in the first human trial because semaglutide had a first trial. It is going to have a trials coming years, but the first trial it showed encouraging. Despite the encouraging results, the contrast here, despite the encouraging results of this first trial, a lot more testing will be needed. So it is not finalized. It is only first trial. So option B is the correct answer. So this is about the part coming to the question 16. According to some research, the WHO International Agency for Research on Cancer recently took coffee off its list of suspected carcinogens, and some research, you see the keyword here, according to some research, according to some research, and here some research suggest it could, modal verb, it could help keep colon cancer from coming back. What is this colon cancer from coming back? That is nothing but coming back is prevention. Okay, coming back is prevention. Then other studies suggest drinking coffee might stave off Alzheimer's and Parkinson's disease. So what is the answer here? Coffee can be used as an effective treatment for Alzheimer's and Parkinson's disease. It is not given. Alzheimer's and Parkinson's disease can be caused by coffee. It is not given. Alzheimer's and Parkinson's disease can effectively be prevented by coffee. They are not given. Effectively, they are not told. Drinking coffee may help with the prevention of Alzheimer's and Parkinson's disease. Yes, that's the answer. Why? Because they say could help colon cancer coming back after treatment, and other studies, because some studies, no, other studies suggest drinking coffee might stave off. Might is the modal verb, may is the modal verb. So in both question as well as statement, as the text has got a modal verb. Prevention is nothing but stave off. The synonymous language, prevention is stave off. So the option D is the correct answer. You look for modal verbs. You see there is a modal verb here. There is some research, some, scale is there. Suggest, suggestion is there. Could, modal verb is there. Colon cancer coming back is prevention again. Other studies suggest, other studies is some studies. Suggest is there. Drinking coffee, yes. Might stave off, might prevent, may prevent. This is the same thing. Yes, now let's move on to the next question, that is, which of these effects is not attributed to drinking tea? As for the strategy, we use QTA method. You read the question, then you go to the text, and then you go to the options. So as we read the text, as we are going to read the text, researchers are still trying to pinpoint the exact ways that happens. But tea, particularly green tea, is rich in compounds like antioxidants, which can limit cell damage and boost the immune system, and polyphenols, which have been shown to lower blood pressure and cholesterol. It also may help stave off Alzheimer's disease through a polyphenol known as EGCG, which prevents the formation of plaques that are linked to that brain damaging illness. So what does this talk about? Drinking tea is attributing decreasing risk of breast cancer. It does attribute strengthening the immune system, and it does attributes decreasing the risk of developing Alzheimer's disease. But exact opposite, that is increasing the blood pressure, which is not given. So it is shown decreased blood pressure but not increasing blood pressure. So the answer for this question is B, that is increasing blood pressure. Let's move on to the next question. What does fourth paragraph suggest? What is the fourth paragraph? You have to read through it and you will find which is the fourth paragraph. As I said, you need to number the paragraphs. So it is written in the fourth paragraph, the topic sentence is like this. Is one better for you than the other? Experts say that. Hard to say. That's because it's difficult to separate out their different ingredients, their role in your diet, and their effects on different body systems. So, what does fourth paragraph suggest? Suggestion is there. They suggest that it's easy to determine the positive effects of coffee and tea. They don't mention about it. That it's not easy to determine positive effects of coffee. They don't mention it. But they do say that it's not easy to determine which one is healthier, coffee or tea? The topic sentence itself is giving the answer. Is one better for you than the other? There's a question mark, right? So it is difficult. And they say that that's hard to say. Hard to say is not easy. Hard to say is nothing but not easy. So the answer is C. That is, what does the fourth paragraph suggest? That fourth paragraph suggests that it's not easy to determine which one is healthier, whether the coffee or tea. Is that clear? Definitely it is very clear, and I think if you understand further strategies, definitely nothing going to be difficult. 19th question. What is Dr. Miller's opinion on the findings? So, opinion of Dr. Miller's. We are not bothered about someone else's opinion, right? So, according to the strategy, let's go to the text. Miller and his colleagues recently looked at signs of heart disease in more than 6,800 people from different backgrounds across the country. About 75% drank coffee, while about 40% reported drinking tea. Drinking more than 1 cup of tea regularly was linked to less buildup of calcium in arteries that supply blood to the heart, a development that can lead to heart disease. Coffee did not have an effect either way on heart disease, but the contrast is here, you see, but that was significant in itself. So, significant in itself is a synonymous language that is used as noteworthy. Noteworthy is nothing but significant in itself. The fact that coffee has no effect on heart disease, coffee did not have an effect either way on heart disease, is the paraphrasing done here. Okay, the synonymous language also they use, paraphrasing is also is there, which clearly says that option C is the definite and the clear answer for question number 19. Why? Let's see one by one. Coffee increases the risk of heart disease in 75% of people who took part in the research. Does they say? No. They tell about 75% drank coffee. They're telling the number of people who drank coffee and number of people who drank tea. But they don't say heart disease is there in these people. Clear? Second, coffee has no effect on heart disease. Does they say? They don't tell exactly like that. They say coffee didn't have an effect either way on heart disease. Okay? But there's a contrast is there. So you have to just think about it. That was significant in itself. So coffee has no effect. No, coffee did not have an effect either way. Or you see there, drinking more coffee than 1 cup. So drinking more than 1 cup of tea regularly was linked to less buildup of calcium in arteries. But they don't talk about coffee drinking and the. So drinking coffee makes your heart excited and is potentially bad. Everyone thinks. Thinking is not the fact here. But coffee has no effect on heart disease is a fact. But everyone thinks it is an opinion. So it is not the answer. So what is the answer? The answer is the fact that coffee has no effect on heart disease is noteworthy is the answer. Hope it is clear to all. Now let us go to the question number 20. What makes coffee and tea beneficial according to Simperman? Let us go to the text. Researchers say that when you have the name of the person, jump to that name. You see, says Lisa Simperman. Simperman says, Simperman said, and Simperman says. So just look at the options now. A secret ingredient found in coffee and tea. Researchers say it's hard to pinpoint exactly how both drinks affect health. Both coffee and tea are complex beverages that contain variety of ingredients. So they don't talk about secret of ingredients, they don't talk, but they say there is a variety of ingredients are there. Second thing, the relations among the complex ingredients coffee and tea contain. Definitely she talks here. What she talks, she says here, it's more of a dynamic interaction than one single compound. Dynamic interaction is nothing but the relationship. Okay? One single compound is nothing but complex ingredients. Okay? Interaction, that is, it's more of a dynamic interaction than one single compound. That means some people have tried to isolate one element but they could not. So what it says is the relations among the complex ingredients coffee and tea contain is what makes coffee and tea beneficial. Hope it is clear to all, because you see they say both coffee and tea are complex beverages. Complex beverages are nothing but complex ingredients, or variety of ingredients are nothing but it is complex ingredients. So the answer is understood because it is just the synonymous language they used. Relations among is nothing but it is it is dynamic interaction, right? So complex beverages, variety of ingredients, all they talk about complex ingredients that coffee and tea has, which will make them beneficial according to Simperman. Hope it is clear to all. Question number 21. What does linear suggest in 7th paragraph? Linear. So father has clearly explained this when he dealt about lexical questions. What we say is lexical questions he talked about. There he has clearly told about this question. So please go back to father's video and watch. You will definitely understand. What does linear suggest? Let us go there. There's a direct, it is said, there was a significant and linear association between drinking coffee and lower risk of colon cancer, returning in those who drank 4 or more cups a day. The more coffee they drank, the lower risk of recurrence. That's a linear relationship what he talks about. That drinking coffee is proportional to the prevention of reoccurrence of colon cancer. That means the more coffee they drink, the risk is less. That is what they talk about. This is about lexical question and it is very simple to understand. Let me proceed further. Which of the following points is not made in 8th paragraph? So, other researchers are asking questions about what role genetics and lifestyle play into the effects of drinking coffee or tea. For instance, coffee and cigarettes once went together like coffee and cigarettes, which cause cancer and heart disease. Some people's bodies process coffee differently than others, says Martha Gulati. Okay? Meanwhile, a preference for tea over coffee might reflect other healthier behaviors. So, what is not made here? Coffee can affect people differently. Yes, they said here some people bodies process differently than others. So, the option number 1 is made in the paragraph. People lifestyle may play part whether they drink coffee or tea. Lifestyle, they talked about lifestyle. Definitely it is there. They might reflect other healthier behaviors. Healthier behaviors are nothing but lifestyles. For example, does someone who drinks tea do yoga or medication? That is, they talk about exercising. These are the lifestyles they talk about. So it is mentioned. Research has shown there's a direct connection between drinking coffee and tea. Smoking, yes, they talked about smoking. They said here, for instance, coffee and cigarettes once went together like coffee and cigarettes which cause cancer and heart disease. They talk about it, but there is no connection between genetics and whether people drink tea or coffee. Nothing about genetics they talked. So genetics is not mentioned in this paragraph. So answer C is the correct answer. Is that clear? Thank you. If at all you have any doubts, you can raise questions or you can put the comments in the comment section in the YouTube channel and we will get back to you in the interaction group. Thank you so much. Once again, I thank Father for giving me an opportunity to present what I learned from you. Thank you so much.